Hello, I'm Dennis Quaid. The field of healthcare is constantly changing and improving. Every day, modern medicine holds the promise of a new treatment or healthcare technology. It takes the vision of determined, thoughtful leaders to unlock the next big breakthrough, as we're about to see.
Healthcare has always been a complicated and sensitive subject in America, and with 31 million Americans without insurance, those who are lucky enough to be covered under their employer may not receive the benefits they need, or even a simple choice in selecting their provider. Today, improving quality access for individuals must remain a key focus for the industry. But what can their employers do?
So one of the big challenges with healthcare premiums is that in 2020, insurance industry made $31 billion. The prior year, they made $22 billion. So when you see that kind of an increase from year to year, that's being passed on to the consumer or the patients. And the employers are the ones that have to pay for this. So each year they've got an escalating bottom line.
Employers, when they do sign up for their health insurance, in order for them to provide affordable premiums, they're having to give their employees very high deductibles. So what that leads to is that when you have an employee that needs a primary care or an urgent care service, they're not going out and seeking that health care that they need because they have co-pays, they have deductibles.
In general, the state of healthcare in this country is kind of a broken product. We still have access to care issues where we have millions of people who still have no insurance or don't have the ability to be able to utilize that insurance at various clinics and support systems nationwide. We find ourselves in a situation where costs continue to increase for insurance products, and yet that access to care, that benefit of care, is still being, unfortunately missed by millions simply because many of those products have deductibles that half of the working force in our country can't afford to pay before they wind up having their insurance kick in.
I started Sterling Urgent Care so that we could simplify everything. Everything in our healthcare system can be reduced down to its simplest form. And this was it, so that they could walk into the clinic, they could call and schedule online or use their app, schedule an appointment to where their chart waited in line. When they walk in, they didn't sit in the waiting room, they walk right back to the room. Provider comes in, visits with them, takes care of it. They can get their medications, their labs, their x-rays, their DOT physicals, all that type of stuff, return to work without all the paperwork sitting there waiting and waiting and waiting, taken care of right here. And if they can't come in, we provide telemedicine for free. We have to remain flexible to where it's custom designed because each company uses it differently.
Being that we are employer owned, there are a wide variety of services that we can offer to our employers and their employees. So not only is it the urgent care services, but we also offer the primary care services. We offer occupational medicine, work-related injuries, drug testing, DOT physicals. All of those can be done within our clinics. If there is a service that needs to be done outside of the clinic, then we will work with a case manager and we can also negotiate those cash pay rates.
The savings for the employers, it's jaw-dropping at times because there's so many different ways we save them money, both from dollar for dollar what they pay in memberships versus what we would have been paid through insurance. They save money through case management. There's work comp savings, there's access to healthcare savings. Telemedicine, which is something that's included for all of them at no cost, also offers substantial savings. So for all of our employer groups, over $100 million in savings, it really adds up for the market that we're in.
Working with Sterling Medical and having Sterling Medical as an option, they can control that increase in their healthcare insurance, provide better service and accessibility for their employees. And then secondary to that is the workers' comp portion. So you have some of my clients are manufacturing clients, and where people get injured or cut or injured with their back, having a reliable source to treat their employees with workers' comp is critical.
One of the things that's also rewarding is that when we see patients that start being able to apply this model and they start coming in, they may never have had a physical in their lives. And then we do a physical and we find out that they've got one problem or another because of the simple diagnostics that we're able to do in-house. And we can actually take steps to make sure that those things are addressed so that it doesn't become a tens of thousands of dollars worth of problems 5-10 years down the road.
Any employer benefits from having Sterling involved. We had an employee that went into Sterling, they caught a helicopter on a life flight later that day because the provider at Sterling found something with their heart. Saved their life. That employee would have stayed home if he had to go pay $100 or whatever it would have been to see another care provider. So my answer to anyone looking into it in any size in the industry is that this is a home run, and if you go to your HR rep or you go to your insurance agent and they tell you this doesn't work, then you need a new agent.
Sterling is constantly growing. We're keeping pace. As of today, we're actually opening a clinic in Richmond, Utah. When you see the town, it's actually one that you would never anticipate a clinic being. What it does, it doesn't make sense from a balance sheet standpoint, but what it makes sense for is the concentration of large employers. We're going to so many rural communities and we're able to provide it out there, a high quality service at an affordable price, the access, and those towns are growing. From a personal standpoint, very fulfilling to see that those people are getting the help that they need. We've got some major crises coming with regards to mental health, which we're participating in, that's able to keep more of those patients there and solve some of those problems. And so overall, we're helping businesses grow, we're helping communities grow, and we're having fun doing it.
Sterling Urgent Care. Take control of your health care. For more, visit sterlingurgentcare.com.
We're glad you could join us today. I'm Dennis Quaid. See you next time.